Thoracic outlet syndrome. The anatomist refers the superior thoracic aperture as the thoracic inlet. This is the superior thoracic aperture. They refer the thoracic inlet because non-circulating substances such as food and air enter the thorax through this aperture. This is the superior thoracic aperture. Now, in opposite way, the clinicians refer the superior thoracic aperture as the thoracic outlet because the arteries and nerves emerge from the thorax through this aperture. These arteries and the T1 nerves emerge through this aperture, supplying the upper limb. Thoracic outlet syndrome. Various types of thoracic outlet syndrome exist in which emerging structures are affected by obstructions of superior thoracic aperture. Although thoracic outlet syndrome implies a thoracic location, the obstruction actually occurs outside the aperture, in the roof of the neck, and the manifestations involve the upper limb. Thoracic outlet syndrome is nothing but this is the compression of arteries and T1 nerves which are emerging from the superior thoracic aperture. The symptoms involve the numbness of the area of upper limb supplied by T1 nerve. There is the ischemia of upper limb because of the compression of arteries supplying the upper limb.